Hello, gentlemen. I'm Dr. Anderson, working with many patients over 50. I've noticed something. Many gentlemen are still hesitant or skeptical about masturbation in their 60s and beyond. They ask themselves, is it still normal, or can it lead to undesirable consequences? Today, I want to share with you 12 real risks. The goal is not to alarm you, but to help you make conscious and informed choices on your self-care journey. 12 risks of masturbation for men over 60. First, I often encounter gentlemen experiencing pelvic numbness after masturbating. The cause is usually compression of the pudendal nerve, often due to an improper or prolonged bent posture. This nerve controls sensation in the genital area and prostate function. If damaged, it can cause sensory disturbances or difficulty controlling. Urination. Second, it's very common to experience small skin tears and infections, especially without lubrication or with excessive friction. These minor abrasions can easily become entry points for bacteria, leading to dermatitis or urinary tract infections. Next is the phenomenon of decreased sensitivity, where the body only responds to a specific type of stimulation. This makes real life intimacy difficult, as actual experiences are significantly more diverse. Fourth, masking erectile dysfunction. I've seen many cases where men can achieve an erection through masturbation but lose the ability when with their wife or partner. This is a warning sign for underlying issues like vascular problems, diabetes, or hormonal imbalances. Fifth, gentlemen use masturbation as their sole therapy for stress relief. It can easily lead to an emotional dependency, meaning they feel restless if they don't do it, even if they are tired or sad. Sixth, this habit can also lead to social isolation. When it becomes a way to avoid interaction, many gentlemen may increasingly distance themselves from friends and family, leading to feelings of loneliness. Seventh, many men admit to having felt guilty or ashamed about this habit, as if they were doing something wrong. This very feeling makes them continue to hide it and blame themselves instead of freeing themselves through acceptance. Eighth, excessive masturbation can lead to pelvic congestion, causing a heavy, aching sensation in the testicles or lower abdomen, a signal that the body needs time to rest. Ninth, if you still desire to have children, daily ejaculation can reduce sperm count and quality in the short term, something many people don't realize until they undergo testing. 10th, it might sound surprising, but it's true. When comparing oneself to images in pornography, it's easy to fall into unrealistic performance expectations, leading to significant psychological pressure. 11th, bacteria from minor skin abrasions that are not properly managed can lead to infections, even in such delicate skin. Finally, 12th, the pressure to achieve the perfect orgasm. This can lead to mental tension, creating a state opposite to the relaxation intended by masturbation. I understand that hearing all this might cause some worry, but please remember, this is not meant to scare you, but rather to allow each of you to reflect and make more conscious choices. That is the path to maintaining physiological health at age 60 and beyond. Gently and sustainably. In the next part, we will explore some surprising benefits that, if utilized correctly, can positively support your physical and mental well-being. Stay tuned. Gentlemen, hearing about these 12 risks might make us pause. But please don't rush into fear. It's precisely from the breadth of these risks that we learn to be more mindful, to make the right choices, protecting our bodies while preserving our natural instincts. Next, I want to guide you through a lesser discussed but truly valuable aspect: the significant benefits when masturbation is understood correctly, not just as temporary relaxation, but as a contribution to a holistic, healthy journey in your 60s and beyond. Surprising benefits of mindful masturbation: reduced risk of prostate cancer. Large studies, including those from Harvard, show that men who ejaculate more than 20 times a month have about a 20 to 30% lower risk of prostate cancer compared to those who ejaculate less than 7 times a month. The explanation is that each ejaculation helps flush out waste, reducing accumulation in the prostate gland, improved circulation, and penile tissue elasticity. Regular orgasms help maintain blood flow in the erectile tissues, supporting sustained erections over time. Strengthened pelvic floor muscles thanks to the contractions of the perineal muscles during orgasm. We activate muscles like the pubococcygis, which are crucial for ejaculation, control, and preventing urinary incontinence. Reduced cortisol. The stress hormone after orgasm, oxytocin and serotonin increase, while cortisol decreases, promoting relaxation and reducing anxiety. Release of happy hormones, dopamine, endorphins, oxytocin, and prolactin are all released, creating feelings of euphoria, relaxation, and satisfaction. Improved sleep. Many gentlemen share that after a natural release, they find it easier to fall into a deep sleep thanks to oxytocin and prolactin, which help relax the nervous system. Natural pain relief endorphins help reduce pain, including muscle aches and mild headaches. Some gentlemen have used masturbation as a way to gently ease fatigue and soreness, increased self-confidence and body connection. Understanding your body and exploring personal sensations helps boost self-confidence and improve self-image. Maintain sexual function. Masturbation helps maintain libido, sensation, and physiological responses, keeping the sexual flow strong even with increasing age. Stress reduction and overall mood improvement. The released hormones help clear negative emotions, bringing a sense of calm and relief. Support for cardiovascular health and immune system. Some research suggests that sexual activity, including masturbation, helps boost immunity and protect cardiovascular health. Supported ejaculation. Controlled by practicing the stop-start technique, we can learn to prolong arousal, enhance emotional regulation, and create a more profound sexual experience with a partner. So, when done consciously, safely, and appropriately, masturbation is not just a natural need but also a valuable medical and psychological tool. It supports prostate health, mental well-being, sleep, confidence, and overall quality of life in your 60s and beyond. However, the key remains understanding your body, maintaining balance, and combining appropriate methods. Before we get to the final part, gentlemen, I want us to take a few minutes to review what we've discussed. The goal isn't just to hear it, but to truly understand and apply it correctly. Key takeaways for mindful masturbation. Frequency varies, but be mindful. A suitable frequency isn't the same for everyone, but a common guideline is not more than 5 to 7 times a week. If you do it more often, ensure you're not experiencing fatigue, congestion, or skin irritation. This frequency allows your body to reset without undue pressure. Posture and method are crucial. Your body isn't designed for just one fixed position. I recommend varying your posture while sitting, lying down, and using lubricant. This not only helps reduce the risk of injury, but also keeps sensations diverse, preventing desensitization. Master ejaculation control. The stop-start technique is incredibly effective. Instead of focusing solely on the destination of orgasm, focus on the process, feeling your body, regulating your rhythm, and understanding your reflex threshold. Mindset is key. Masturbation shouldn't come with feelings of rush, obsession, or guilt. See it as a part of self-care, gentle, calm, and conscious. Your body in its 60s needs gentleness, not pressure. Regular checkups and self-monitoring are essential. Oral health, blood pressure, blood sugar, prostate. This isn't just about exercising your penis. It's about combining a proactive mindset with scientific data to protect your overall health. A patient's journey. John's story. I want to share a story about a patient. Let's call him John, 67 years old. John came to me experiencing erectile dysfunction during intercourse, yet he could achieve excellent erections when masturbating. He felt frustrated, wondering if he was doing something wrong or if there was something wrong with him. After discussing his situation, we decided to implement a plan together, reduced frequency to 3 to 4 times a week, combined with safe lubricants. flexible. Postures, avoiding prolonged bending. Practice the stop-start technique, helping John listen to and control his tipping point. Added gentle pelvic floor exercises daily, along with at least 30 minutes of walking. Just 8 weeks later, John contacted me. His erections were more responsive. Real intimacy no longer caused anxiety, and he even slept deeper. Most importantly, his emotions were calmer, no pressure, no guilt, just a newfound confidence and peace in his body and mind. John told me, "I used to think something was broken with me. But now I understand I just needed to do it the right way, with mindfulness, without any extra pressure." Gentlemen, we've just completed a journey of balance from the 12 risks we need to be aware of to the 12 significant benefits when done correctly. So I want to emphasize once more, masturbation, more than just pleasure-proper masturbation, isn't just about physical pleasure. It can be a part of your overall health care. It can boost erectile function, improve circulation, reduce the risk of prostate cancer, support better sleep, and balance your mood with happy hormones like dopamine and oxytocin. SourceHealth.com reduced prostate cancer risk. This isn't just anecdotal. Medical research indicates that ejaculating 21 times per month can reduce the risk of prostate cancer by 20 to 30%. Deeper sleep, less stress, masturbating before bed helps lower cortisol and increase prolactin and oxytocin, relaxing your nervous system, making it easier to fall asleep and achieve deeper sleep. Source: verywellhealth.com. The keys to mindful masturbation. Most importantly, all these benefits only come to fruition if we practice with awareness, safety, and balance. Maintain a suitable frequency on average, 3 to 5 times a week or less if that feels right for you. Use lubricant, vary your positions, and incorporate ejaculation control techniques. Listen to your body if you notice any unusual symptoms. Proactively get them checked out by a doctor. In our 60s and beyond, we're not looking for pressure. We're looking for ways to live healthy, mindfully, and confidently. Masturbation, when it becomes a conscious and scientifically informed act, it's a valuable part of that journey. If this video has helped you realize something important about your sexual health, please leave a small comment sharing your thoughts, questions, or story. If you want to explore more emotional control techniques, pelvic floor exercises, or guidelines specifically for men over 60, don't forget to subscribe and turn on notifications so you don't miss the next video. Thank you for your time. Gentlemen, I wish you continued health, peace, and confidence on every step of your journey ahead. See you in the next video.